My name is Richard Master, 250 East Makeda Road in Bethlehem, Pennsylvania. I'm here with my wife and a number of supporters for the Medicare for All referendum that you're going to be is going to be presented. Resolution. Thank you for considering this resolution and permitting us to speak in support. We're trying to limit the number of folks who speak in view of the busy agenda of the council. We are joined by many folks tonight, union representatives, the Women's March state coordinator. We have 800 members of the Lehigh Valley Task Force for Medicare for All. I'm going to make a little joke. They are on 12 buses around the corner ready to launch, but not a great joke. The state director of Medicare for All is here, Noah Levinson. We face a crisis. Our nation's healthcare sector is eating the rest of the economy and our society alive. A family plan at my company, MCS Industries, costs $28,000 a year. That's $14 an hour. Our costs are rising, and we're expecting a 10% increase next year. The burden of healthcare expense on this city is profound, and moreover, it's volatile. You don't know from 1 year what the increase in cost is going to be, and it's very difficult to budget. The only way to get this issue under control is by instituting a federally financed, privately delivered healthcare system known as Medicare for All. Medicare for All will substantially reduce administrative cost, pharmaceutical and hospital costs for this city and its residents. Most importantly, it will keep cost increases under control into the future. At the same time, it will provide health care coverage to many Bethlehem residents who are now uninsured, and to those many more who are underinsured and are foregoing care because they can't afford the high deductibles, co-pays, etc. Incremental reform will not do the trick. We've tried that. This city and its taxpayers cannot afford more of the status quo. The resolution before you is also slated to be presented to Easton City Council and ultimately Allentown as well. Last night, the City Council of Los Angeles passed the same resolution in support of federal Medicare for All legislation, joining San Francisco, New York, Seattle, Minneapolis, and in Pennsylvania, Philadelphia, Pittsburgh, Norristown, Reading, and many other cities across the country. Of particular note is that our Congresswoman, Susan Wild, is a co-sponsor of Medicare for All in the House, H.R. 1384. We need to support her in this effort. Let's speak as one valley, one voice, advocating real reform to health care for our citizens and our city. Thank you very much.
Thank you, Mr. Master. And